Hi, everybody. Thank you so much for spending your half an hour with me. This is my first webinar, so apologies if it's a little bit awkward. So I would hope that this talk is meant to provide some information and hopefully get people curious. So the first thing I wanted to do is to just have a disclaimer. I am not a nutritionist. I am a breast cancer surgeon. And these are the topics that we're going to be covering hopefully in the next half an hour. I would love to have questions at the end. But I've got 36 slides to get through. Some of those are just placeholders, but I'm hoping that I will answer a lot of questions as we go. The first thing I wanted to say is that who am I? Why am I interested in this topic? So my own story is that I've been a breast cancer surgeon here at Swedish for about 12 years. And obviously, the mainstay of my practice has been treating women who either have breast cancer or are at high risk for breast cancer or have gone through breast cancer treatment, so kind of along the whole spectrum. My own personal story is that I have very high cholesterol, strong family history of heart disease in both my maternal and paternal sides. And despite my efforts to exercise and, quote, eat right, I still had very high cholesterol. And my sister, who's a couple years older than me, was recommended to go on a statin. And I really did not want to go on a statin myself. So I started doing some investigating about ways that you could truly reduce your cholesterol with diet. And I started doing, I first cut out meat, and that didn't really have that much effect on my cholesterol. And I'm trying to go to next here. And I thought I was a pretty smart doctor, and someone had recommended that I watch this movie called Forks Over Knives. And I really thought that I knew how to eat healthy, and then I saw this movie, and it sort of kind of blew my mind. This is a documentary. It's available on Netflix and Amazon and multiple places. I highly recommend, if you're interested in this topic, to watch the movie. It is basically about a physician who's a surgeon by the name of Caldwell Esselstyn and about a PhD by the name of T. Colin Campbell. And these are two gentlemen that are sort of the pioneers in learning about or developing basically whole food plant-based diet. Dr. Caldwell Esselstyn was actually a surgeon at the Cleveland Clinic who treated both heart disease patients and breast cancer patients. And he even grew up on a dairy farm, I believe, himself, and really was compelled by some of the science, and he started doing his own research with a group of very advanced heart disease patients. And it's talking about his life's work and his experience. And he has some really impressive research done on a group of patients who he was actually able to reverse their heart disease. Dr. T. Colin Campbell is the other sort of main character in this documentary. And he also grew up on a dairy farm, and he has done extensive research on nutrition. And his famous study is called the China study, which looks at basically eating patterns in China and what incidence of cancer were based on those eating patterns. Interspersed throughout the movie is also, of course, people who are actually being profiled, going through the experience of changing their diet and therefore changing their health. And it was really impressive and kind of led me to make this change. So why is diet important for cancer, health, and overall wellness? Again, I initially started to get interested in this for my own health about cholesterol, but the more I read about whole food plant-based diet, which is what I'm going to focus this talk on, it was amazing how many effects it has on multiple types of cancers, heart disease, diabetes, and just overall wellness. And of course, all the time as a physician, I'm asked by my patients, what should I eat? And of course, being taught almost, nothing about nutrition or diet in medical school, I sort of would have a blank look on my face and try to come up with something smart. And yet now I feel I have enough knowledge to be able to, if asked, to discuss potentially trying out a whole food plant-based diet. So just some of the data. So about 90 to 95% of cancer is associated with lifestyle. Recent estimates have been that 35% of cancers are due to dietary choices. It's responsible for about 70% of colorectal and prostate cancer, 50% of breast cancer, endometrial, pancreatic, and gallbladder cancer, and 20% of lung, bladder, mouth, and esophageal cancer. Obviously, the other lifestyle factors that are contributors include tobacco. About 25 to 30% of cancers due to tobacco use, so therefore diet is now a greater contributor. Alcohol, about 4 to 6% of cancers related to alcohol intake, obviously sun exposure, environmental pollutants, infections, viruses, about 15 to 20% of cancers are related to infections like HPV and whatnot. We know that stress plays a role. Obesity, about 10 to 20% of cancer is related to obesity, and obviously physical inactivity as well. This was a slide provided to me by Dr. Ann Pittier, who is actually a radiation oncologist in Tacoma, who really gave an excellent talk about some of the science behind a whole food plant-based diet and cancer. In addition, we know that obesity is an epidemic in this country. We know that obesity increases the risk of developing cancer as well as from dying from cancer. 55% of cancers in women and 24% of those in men are linked to obesity. And the cancers that are associated are listed all here, the various forms of cancer, including breast as one of them. We know that excess weight and obesity is clearly linked to cancer recurrence and to survival. Mortality from breast cancer is 35% higher in obese women, and even death from multiple myeloma is 50% more likely in obese patients. So we know that the five of the 7 leading causes of death in the United States are related to unhealthy diets: heart disease, cancer, stroke, Alzheimer's, and type 2 diabetes. So again, why was I interested in cholesterol? Because we know that high cholesterol is actually linked to an increased risk of developing breast, prostate, and colon cancer. So what is a whole food plant-based diet? So what's interesting is 75% of Americans believe that they are actually healthy. However, less than 3% actually live a healthy lifestyle, which is defined as healthy diet, adequate exercise, which is 30 minutes of exercise 5 days a week, having a normal body mass index and normal weight, and not smoking. So if we use that as a definition of healthy, 70% of Americans are overweight, 40% are considered obese. However, only about 36% of people think they're overweight or obese, and 50% of Americans in the US spend 10 minutes per week or less on leisure and physical activity, and 33% of us are completely sedentary. So we have a big problem, and currently, what are we eating? Well, most of us are eating what's referred to as the SAD diet, which is the standard American diet. The standard American diet is about 63% refined and processed foods, which are basically empty calories, which really don't provide much health benefit. We're consuming about 25% of animal-based products. That includes meat, dairy, eggs, and all that stuff are basically disease building blocks laden with fat and dietary cholesterol. We're only eating about 12% of plant-based foods, and 6% of that comes from French fries, which is considered plant-based, and leaving only about 6% of daily caloric intake from plant-based foods. And this includes things like fruit juice and ketchup. We are consuming right now an average of 185 pounds of sugar and sweeteners every year, and we're consuming an average of 3,400 milligrams of salt a day, which is more than double the amount and triple the amount recommended by many experts, with the majority of it derived from processed foods. So, what is a whole food plant-based diet? It's a way of eating, and the reason I use that term as opposed to diet is diet makes me always think of something temporary, like I'm going to do this diet for 6 months and see what happens. But I like to talk about this being a way of eating because it is a lifestyle change and hopefully one that can be sustained over time. This way of eating is centered on whole or unrefined or minimally refined plants, fruits, vegetables, tubers, whole grains, and legumes, and it excludes or minimizes meat, chicken, fish, dairy products, and eggs, and highly refined foods like bleached flour, refined sugar, and oil. But wait, isn't that vegan? Well, I would beg to differ because all these foods that I have pictured here are vegan. Oreos, Doritos, there's marshmallow fluff, French fries, tofurkey, a lot of the sort of vegan substitutes, beer, and this is really not what whole food plant-based diet is. Vegan does often mean no animal products whatsoever, and there are lots of vegans who will not even consume honey because it's created by bees. I do eat honey, and I do wear leather. So there is a difference between veganism as sort of a social cause and whole food plant-based diet. But yes, in a restaurant, when I'll ask often, what are the vegan options? Because people understand that vegan is usually no meat, no dairy, no eggs. Butter is sometimes difficult because people don't think of that as dairy, but that would not be vegan either. But there are a lot of vegan snack foods, and the thing about veganism is you can be a fat vegan eating a lot of processed vegan foods. I would say that my own personal experience is that I needed some of those substitutes while I was transitioning in terms of cheese and some of those things, and but I have to say that I was always sort of semi-disappointed when I would try to eat the mac and cheese and it just wouldn't taste like Kraft mac and cheese. And once I sort of realized that it was going to just taste different and that I wasn't going to taste exactly like the original, I was more satisfied with that. And I think that, again, focusing on whole foods is what's important. So here's a really great kind of new pyramid. So at the top are fats and oils, almonds, pecans, walnuts, avocado. I love avocado. But again, in moderation. A lot of leafy greens, spinach, broccoli, kale, lettuce, chard is another one. And then the legumes are also very important. There's some really interesting work that's done by somebody called the Blue Zones, which is basically looking at where do the longest living people on Earth live and what do they eat. And legume consumption is actually highly correlated with longevity, which is kind of interesting. Grains would include whole wheat bread, oats, brown rice, pasta, whole wheat, tortillas, granola, quinoa, barley. There's also some other other interesting new grains. Amaranth is another one. Orzo, if you could find a whole grain orzo, there are lots of different kinds of rice out there. And then in terms of, fruits and vegetables are really composing the majority of the diet. So how does diet impact cancer? Well, a whole food plant-based diet basically is obviously promoting a high consumption of vegetables, legumes, grains, and nuts. And those things, of course, have lots of fiber. And high fiber really does impact how our gut and our liver process and circulate hormones that we intake in our body and that our body creates. Having all this fiber around also inhibits the absorption of toxins and carcinogens. A whole food plant-based diet also minimizes animal-based products, including dairy. And I love how it says minimizes. It doesn't say eliminate forever, because that just breaks people's heart if they hear like, I can never have a hamburger ever again. But again, this is about minimizing. I'm not saying never, never, never. So the thing about reducing animal-based products is animal-based products, one of the things that they do is that when you eat an animal-based product, you are stimulating insulin growth factor, which is actually something that stimulates the growth of cells, which is bad, obviously. So we know that animal consumption, this increase in insulin-like growth factor, can potentially promote tumor growth. Also, by minimizing how many animal products you consume, you reduce your cholesterol. It actually optimizes a healthy weight. It is anti-inflammatory. There's lots of good data about people being able to improve their symptoms from their rheumatoid arthritis eating this way. It obviously is minimizing the intake of hormones and, of course, all the tons and tons of bad bacteria, which are in a lot of animal products. 80% of antibiotics in this country are given to animals. So they are just full of all of this stuff. Eating this way also can reduce and reverse diabetes type 2 and coronary artery disease. And we also know that eating this way does reduce cancer development and potentially slows cancer progression. So here is some of the data about plant-based dietary patterns and cancer risk specifically. So the first study is the prospective analysis of the relation between dietary fat intake and breast cancer, which was part of the Nurses' Health Study. It was over 90,000 women, and intake from animal fat included red meat and dairy foods, and it was associated with an increased risk of breast cancer. The Adventist Health Study, Adventists, many of them are vegetarian, almost all of them are vegetarian, and many of them are vegan. And they looked at the diets of over 69,000 people, which were tracked for more than 4 years. And they noted that vegetarians had a 24% lower risk for GI cancers, so colon and rectal cancers. And vegans had a 16% decrease from all cancers. And vegan women in particular had a 34% decreased risk for specific cancers, including breast, ovarian, and uterine compared to non-vegetarians. A 2014 Harvard study found that a serving a day of red meat during adolescence was associated with a 22% higher risk of premenopausal breast cancer. And one serving a day of red meat consumption in adulthood was associated with a 13% higher risk of breast cancer overall. In addition, the World Health Organization announced in 2015 that processed meat is a class 1 carcinogen and red meat is a class 2 carcinogen. There are 22 experts from 10 countries reviewing more than 800 studies to reach these conclusions. So about one hot dog every day increases the risk of colorectal cancer by 18%. Red meat increases the risk of colorectal, pancreatic, and prostate cancer. Now, the reason that these processed meats can be harmful is that these nitrate salts within these meat products, they can be converted to these N-nitroso compounds, and they can react very quickly and cause DNA damage locally. And if not corrected, these mutations can lead to cancer. Now, you may see on products that it reads something that they're nitrate-free, but that usually means that they're using a ton of celery salt, which is already high in nitrates and can react in a similar way. So you don't get away with too much with nitrate-free. And then unprocessed red meat, even though it's organic and even though they sing to the cows, you know, as they're eating, unfortunately, it's the fact the meat, this muscle, forms these nitroamines when we heat it, when we cook it. So again, one of the benefits of whole food plant-based diet is it literally contributes to longevity. Vegetarians and vegans, on average, they live 6 to 10 years longer than those who consume meat. In addition, we know that it lowers your risk of heart disease and of cancer. So meat eaters are twice as likely to develop, likely as vegetarians to develop heart disease. And again, that's really our #1 killer in the United States is heart disease. So I also love this slide looking at types of cancer and comparing it to developed countries versus developing countries. So even though we spend so much on healthcare, the United States substantially more on healthcare than any other developed country. And in 2009, our health spending in the United States was 90% higher than in many other industrialized countries, yet it ranks near the bottom with health outcomes. So you can see that breast cancer, very, 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 very high in developed countries compared to developing countries. And same with lung cancer. So lung cancer and breast cancer, as well as prostate cancer, they're diseases of industrialized, wealthy nations with a high standard of living. So next thing is here's another great one looking at, this is why I want to move to Laos, because this is looking at percentage of death from heart disease and cancer versus percentage of calories from unrefined plant foods. And you can see that in the United States here, high up here, we've got basically death rate here and incidence of cancer and heart disease, 75%. And the amount of plant-based foods that we actually consume is very low. I guess I'm going to move along here to try to get to some of the other stuff. So here's a really great graphic that I like to look at, which is basically from the Physicians Committee for Responsible Medicine. And it basically, you can go through and see how these things increase your risk in relation to the type of cancer. So you can see dairy here increasing prostate cancer, and you can see alcohol and meat increasing colorectal cancer. And yet, if you eat more veggies and more fruits and carotenoid vegetables and natural soy foods, you can decrease your risk of breast cancer. So people always ask me, you know, well, where do you get your protein? So of course, the largest and most powerful animals in our world are herbivores. And of course, every single time that people ask me about protein. So I love this graphic. This goes through all the different plant sources of protein that are whole food plant-based and vegan. The other thing that people always ask again is, this is actually a great book by Garth Davis, who's actually a surgeon who is a bariatric surgeon, grew up in Texas, went into practice with his dad, and at the age of 36, he went to the doctor because he was having eye problems, and it turns out they were finding cholesterol deposits in his eyes. Anyway, he started to do a lot of research and basically went into all the data about why we're sort of under this myth that protein is just, you know, the bee's knees and everybody needs lots of protein. The next thing that patients always ask me, of course, is what about my calcium if I'm not eating cheese and drinking milk? Well, there are tons of plant-based calcium sources. A lot of them are green here. So sesame seeds, it doesn't always have to be soy milk. Mustard greens, pumpkin, carrots, tomatoes. There are actually lots of other ways to get calcium besides dairy. Real quick, I wanted to cover soy. So early studies showed that soy consumption in rats promoted estrogen-dependent mammary tumor growth. However, we're not rats. And soy foods are actually very rich in isoflavones, which are phytoestrogens, and they're actually a natural estrogen receptor modulator. So it actually competes with the estrogen receptors, and it actually increases the synthesis of steroid hormone binding globulin and increases the clearance of steroids from the circulation. So it actually enhances the immune system. It inhibits the ability for tumors to create blood vessels. It actually induces programmed cell death. Here's a great study looking at soy food intake after a diagnosis of breast cancer and survival. And actually eating 1 to 2 servings of whole soy can actually reduce your risk of breast cancer recurrence by 25%. This is another great study looking at those in China and US. And again, those with the highest soy intake compared to the lowest, they had a 36% reduced risk of recurrence and a 29% reduced risk of breast cancer mortality. So what does your plate look like? Basically, it's going to look different. It's more fruits, veggies, tubers, whole grains, and legumes. So how to incorporate more plants into your diet? The first thing I always say is the sweet potato rule. I can't stand sweet potatoes. You don't have to like or love everything. That's okay. Find out what you do like. Progress, not perfection. Each meal is a choice. And I always say, check in. How do you feel after you eat something? Yesterday I ate a cookie and I felt bad, unfortunately. But when I eat mostly whole food plant-based, I just feel better. I have more energy. Try to increase how many salads you eat a week. Know that your tastes are going to change, and try not to think of it as depriving yourself of something that actually you're crowding out the bad stuff. So what are the power of plants? Prevent reverse heart disease, help to maintain a healthy weight, lower cholesterol, lower your blood pressure, your blood sugar, reduce the risk of type 2 diabetes, lower your risk of cancer, potentially reduce risk of recurrence, and improve survival. It's good for the environment, reduce your carbon footprint. Longer life, potential to reduce or eliminate medications for chronic diseases. You might have more energy, vitality, and healthier, younger skin. So these are just a few parting words. You can read these at your leisure. But again, I don't want to be the annoying, preachy vegan. I really just want to share my enthusiasm about this topic. And here's another great quote from Caldwell Esselstyn, who is the surgeon I was talking about. And he says, some people think plant-based whole food diet is extreme. 500,000 people a year will have their chest opens up and a vein taken from their leg and sewn into their coronary artery. Some people would call that extreme. So Michael Pollan, I think, said it best: eat food, not too much, mostly plants. These are some resources, some books, and some videos. These are some great websites and recipes that we'll hopefully be sending out later. Some of these have Instagram accounts and websites. Thank you so much. I think